Okay, go ahead.
Okay. Hi, everyone. Welcome to the Campus and Community Advisory Committee. It's been a while since we've all been together. We have new members joining us, and I am happy to announce that I have new co-chairs joining me today, although I certainly miss Shana and Reeves. So I wanted to make sure that I introduced Katie Musgrove to those of you who don't know her, the incoming chair of the Employee Forum. And then I don't know whether Lamar Richards has joined us yet. I know he's been otherwise engaged this morning. And so I think he will be joining us very shortly, our new student body president. So we'll be happy to welcome him.
He's here, Mimi.
I'm here.
Oh, great. Hi, Lamar. Okay, wonderful.
Hi,
We also have a variety of new members joining us today because we have had other student representatives graduate, people in different capacities that have moved around. So I want to welcome anyone who is new to joining us. And the other thing I just wanted to acknowledge before I turn it over to Kevin is that I want to recognize and just be really clear that we are in the midst of a very difficult moment on our campus. And I know that emotions are running very high for everyone. And it probably feels a little strange to be focusing in on questions of masks and vaccine status and opening for the fall when it feels like there is so much uncertainty all around us in the present moment. And yet, I think we all recognize that we have to kind of spin on multiple tracks. And that's what I'm going to ask us to do today, is to stay focused on our agenda, because we do only have an hour and a half together. And I think we need to provide some good advice and recommendations and, ask our best questions and get good answers. So with that, I'll turn it over to the Chancellor.
Thank you, Mimi. And it's great to be here with everyone this afternoon. And I want to thank you for convening in the middle of summer to start talking about, or continuing our conversations really about fall planning. And we are working to update our COVID-19 community standards, and would really like to hear your feedback. I want to just start by saying thank you to those of you who have been by our side over the past roughly 9 months when we convened for the first time as a Campus and Community Advisory Committee. I want to thank those of you who more recently said yes to joining the committee. We really value and appreciate your input now and throughout the past year. It's really been important as we moved forward as a campus community, and we are in a different place today than where we were last fall, and we're grateful for your help to help us get to this point. Our spring semester was successful, and again, thanks to the hard work of so many people, and you'll hear from some of those individuals today. But again, your guidance was really critical for that successful spring semester. I've said on multiple occasions that we are going to work really, really hard to try to have as close to a typical campus experience for our students, faculty, and staff as possible this summer and fall for sure. Yet it won't be quite the same as the fall of 2019 or the fall of 2018, particularly with masks and testing program still being part of our daily routine. And we'll talk a little bit more about that. We know that the best way to protect against the virus is the vaccine. And we continue to receive encouraging news about our campus in terms of the vaccination data. You'll hear a little more about that. I spoke with Ken Pittman, the director of campus health last evening, and he remains very optimistic and thinks that there's probably many more individuals vaccinated than what are currently up in the registry. But we have to continue to remain vigilant and encouraging everyone to try to get vaccinated. We need your thoughts on how we can accomplish that, and your ideas will help guide our decision making as we navigate through the next several weeks You know that we will be, we're preparing to bring back most of our campus employees on starting July 19th. While many of our employees have been back for several months, this date was selected based on a lot of guidance from my staff and advisory committee and others within the administration around being equipped and ready to bring back 30,000 students, about 4,000 faculty, again, many of whom have been back, and 10 to 11,000 staff. So we have to be prepared for that, which, first day of classes, believe it or not, is August the 18th, convocation on Sunday, August the 15th. So we are excited about these opportunities, but we have to be prepared. And I know that there's still some anxieties out there and some uncertainty about our return to on-campus operations. I participated, I listened in the employee forum community meeting that was held earlier this week. I want to thank Shana and Don Osborne and Katie and others for hosting that. I think we heard really important feedback. We heard some frustrations. We heard some concerns, but we also, I think, heard commitment and that people deeply care about the role they play here at the university. And as I've said over and over, that people have worked just as hard, if not harder, throughout this pandemic, regardless of where they were working, and we're grateful for that. But we are working as hard as we can to try to make our campus safe and welcoming, and a welcoming place for all students, faculty, and staff, where they know they belong and their voices are being heard. So with that, again, I just want to thank all of you for joining today, and I'm going to turn it over to Provost Bluen.
My screen is frozen. Can people hear me? Okay. Okay. All right. So I'm sorry, Kevin, who are we starting with?
I'm sorry. I did I freeze?
No.
I think
I said I was going to turn it over to Provost Bluen if he had a few comments.
Oh, I apologize.
Yeah, well, thank you, Kevin, and thank you, Mimi, and thank all of you. I hope, can you hear me okay? I'm in somewhat of an unstable environment right now, both in terms of Wi-Fi and also other factors that I currently cannot control, like grandchildren. I first of all want to echo a lot of the things that Kevin said, and thank you, for the incredible amount of hard work that all of you have already put into this. And the numbers are encouraging locally. I just wanted to share a little bit of positive news for you. The Orange County vaccination rate is now approaching 65 to 70%, depending upon how you count the vaccinations, whether they're fully or partially vaccinated. But I do feel that the county has done a great job. And also, as you may know, we are asking all of our students to notify us of their vaccination status at the point of class registration. And of the 15,000 plus that have indicated to us their vaccination status, 96% have indicated that they are in fact vaccinated, and about 85% of them have uploaded their verification of their vaccination. So both of those statistics, really, I think, are very encouraging. We still have more work to do, and hopefully the final count from our students will continue to be in the same direction. So the RIT, the Roadmap Implementation Team, has also been working very hard throughout this entire spring and summer in preparation for the fall. And I hope to be able to contribute in whatever way I can to this meeting if it's needed for me to clarify some of the thoughts and thinkings of the Roadmap Implementation Team. And so with that, Kevin, I'll turn it back over to you. Thank you again.
Thanks, Bob. So I think the discussion is going to turn to the sort of the planning for the fall discussion around masks, student vaccines, testing, faculty and staff vaccines. And are we turning, Chris, are we now bringing in someone for this?
This is, as Mimi and I talked, you all see the three things that we would like to discuss. And Mimi, feel free to jump in here, but one of the things that we've heard loud and clear is this group did not want a lot of presentations, but more, let's have an open discussion. So the three things that we really need to discuss, and as Bob said, we've talked a lot about masks, but the student testing and vaccine, we have Amir Barzan here to talk about that. Faculty and staff vaccines, Amir can speak to that some. We have Becky Mangini from just the HR side of things. And then we're glad to welcome our new Secretary of the Faculty, Jill Moore, who serves on the State Vaccine Committee, to talk about some of the legalities around vaccines and other things. So Mimi, I would turn it back to you just to facilitate the discussion.
Okay. Well, I'll just please, maybe Provost Bluen, please jump in if there are things that I'm getting wrong. But as I understand it, there has been discussion in the RIT about the level of masking on campus, where masks will be required, where they won't be required, and that there has been some, that there are mixed views on that. And one of the main drivers of those views are questions around the Delta variant. So is there more that we need to sort of know to lay the groundwork to have a conversation and a discussion? And Audrey,
Yeah, I'm happy to, Mimi, I'm happy to at least give a quick summary of sort of the general thinking. And Amir perhaps could also join, because he has also been a part of that conversation and may have a different point of view. But the mask policy for the fall has clearly been probably the most debated topic. We have been watching what other universities are doing, including those within this. And there is a lot of variability out there, everything from no mask requirement at all in any setting on the campus, all the way to full mask wearing, to a perhaps what might be viewed as a compromise of mask wearing in the classroom or instructional locations, for example, the classrooms and the laboratories. And so we have debated these quite rigorously. I think we somewhat fell upon perhaps the latter as perhaps a working proposal, but it would be unfair for me to say that there is unanimity, around that concept. And we really would like to have a healthy discussion amongst this group, to get the various opinions. In terms of the approach for mask wearing within the classroom or instructional activities, one of the expressions of concerns were around equity, and that is that it could be we could be giving people the impression that we are valuing the safety of our faculty and our students in the classroom more than we might be valuing the safety of our staff, as students would be interacting with staff, for example, in counseling and in other environments, and would not have the same luxury of the mandatory mask wearing policy. We have talked a lot about agency and given the CDC's guidelines and as to whether or not individuals should be expected to take more personal agency, and that is if you want to have ultimate protection, then you have agency to get vaccinated. You have agency to wear a mask if you want to be more cautious, and so we've talked about that as well. But so that, I think, has been the general consensus. Chris, you've been in all of these meetings with me with regards to the RIT. Does that accurately reflect kind of the different points of view?
It does, yes, sir.
Well, at this point, let's open it up for some reactions. I mean, what are people's thoughts from, we have folks here from every corner of campus, I think, and how do you see it? What about these questions?
Yeah, I agree, Mimi. And I think, what are you hearing also? I mean, I think that's one of the things we hope that you're able to do, is to bring thoughts and ideas and opinions from your various constituencies. So
Yep.
Thank you.
Well, Mimi, one thing that I failed to mention, and that is, our healthcare experts have weighed in as well. And, they have acknowledged the fact that they tend to be more conservative or cautious, with regards to the mask wearing rules, and their desire, not to see a recurrence of what perhaps might have happened, what happened last fall. And so I think their position is more in alignment with mask wearing for everybody indoors. And that was their sort of the last position. And Audrey, you were part of that conversation as well. It wasn't without some controversy and a lot of rigorous debate, but that has been their most recent position at last week's Tuesday meeting. So,
and I'm sorry, Bob, is it okay if I jump in and just kind of add a little bit more color behind here too? So I apologize for having my camera off. I'm in the hospital over here at Hillsborough. So, but wanted to just add a couple of different thoughts, because I think one thing that you brought up, Mimi, is the discussion about the Delta variant. So just so everyone kind of understands where we are in this, what happens in these cases, or what happens at the forefront of when we're looking at evaluating patients, is that the process is that a patient gets tested, or a person gets tested, and that results as plus or positive or negative. And then from there is where we can potentially send it off for what's called sequencing. Sequencing is what helps us know what variant is out there. As of right now, prior to the Delta variant, we had heard about other variants. The other names that you may have heard are the UK variant, New York variant, California variant. So those were considered what we call variants of concern or variants of interest. And currently, right now, in our general community, those variants entail about 90% of the positive cases that we're seeing. So I say that because it took us a while to get to the point of understanding what variants may look like. Every variant is a little bit different. But even in a setting, just to kind of bring back to where we are in a setting.
Amir, you're breaking up on us.
Oh, I'm so sorry. In a setting of having higher variants of concern, we still haven't seen large swaths of increase or of increased hospitalizations or mortality. So just wanted to give that background as we're trying to figure out the Delta variant.
Okay, well, let's get some discussion going. I see 4 people with hands raised, and Audrey is also putting some helpful pieces in the chat. And I do want to remind our folks that are watching by live stream that they can submit questions to Poll Everywhere or text CCAC 0625. And for questions.
Mimi, do you mind, before we kind of get into questions, if Audrey is willing, can she vocalize some of these comments that she's putting in the chat, if that's appropriate?
Sure, but yeah, okay.
I'm happy to. I just want to give space also for other voices, since the Chancellor and Provost have heard my opinions, and the other ID folks like Mike Cohen and David Weber and Joe Aaron, who I think the Provost summarized well. I mean, I think the evidence suggests, right, indoor spaces are riskier. If you are vaccinated, you are, as Amir said, less likely to have a severe outcome, even though we are seeing infections in individuals who are vaccinated. If you are immunocompromised or have children at home, there is a risk, although obviously we know children are less likely to have severe disease if they do get infected. So I just think agency only goes so far, and the best public health practice is to have structural interventions which protect everybody. That's basic public health 101, right? And so I think that's sort of my opinion and our opinion. And we don't, so far we think the vaccines are working in the face of new variants, but the Delta variant is still new and it's starting to emerge. If we have pockets of unvaccinated people on campus, they are at risk, right? They're at risk for severe disease. And I think that's just something we need to think about. I also worry about agency. So I'm just going to add it in there for our staff. Like as a faculty member, I can walk out of the classroom if someone's not wearing a mask or say we're moving to online, but can a staff member who doesn't have the power or agency in a staff meeting walk out of a meeting when someone's not wearing a mask? Probably not. And so I just think we need to think about everybody on campus, and I'll stop there.
Thank you. All right, Taya, let's start with you.
Hi, so thanks for that, Richard, and thanks Audrey for talking about the public health piece. I'm Taya Jackson Scott, and I'm the Vice Dean at the School of Public Health. And so I want to unpack the discussion about masking, and when we talk about equity and what that means, and what I'm hearing from some of the staff members. So we've had a lot of discussion around these squares and in our own areas, but I haven't really seen any policies that are central to help us with being consistent across each school so that there aren't variations. And so when we talk about equity, we have to think too also about hybrid situations with folks in the classroom, people that are still going to be on Zoom, and people who are challenged with hearing. We've had a number of people talk about those issues about ableness and wondering, okay, what are going to be the requirements from the school in that regard? We also have to talk about, we're still in a pandemic. We've seen a year where there have not been much flu outbreaks. And so I think that agency depends on the person. And so again, going back to policy and practices and being practical, I think that we need to make certain that people really understand that we have their best interest at heart when we're talking about agency. So I'll just leave it there because again, Audrey said it best. If I'm a staff member, I really don't have academic freedom. And if I choose to be in an environment that's best for me, which is not being on site where people can wear masks who have been vaccinated or not, we can't tell. So we don't know who's been vaccinated. We don't know any of these things. And a lot of people are feeling challenged because the pandemic has increase the number of disparities with people having to take care of children, having to take care of parents, and taking that back home is going to put those folks at risk. So that's, what I want, you all to know, that some of our folks are really challenged with some of these issues that we're talking about and not having a consistent practice across the entire school.
Amanda, you want to jump in?
Great. Hi, everybody. My name is Amanda Smithers. I'm the Chief of Staff for the Graduate and Professional Student Government. I'm also a PhD candidate in the Department of Chemistry. So I've talking to mostly my peers in chemistry. As you know, we've all been in person since June 1st, despite the risk, because we are required to in order to complete our dissertation research. All of us in the Department of Chemistry are also required to teach. We don't have a choice. We are absolutely required at least our first year, sometimes more. I know people in their fourth and fifth year who have taught every single semester they've been here. And so what the students I've talked to, what they want to know is how many of us are you willing to risk? So we have vaccines, sure, our department's done really well with vaccinations, but they're not perfect. When we teach chemistry teaching labs, it's a very close environment. There's no way to spread out. You have to be able to supervise and see what the students are doing. And so with no requirement of vaccination, despite the fact that there's public universities across the country requiring it, but then also getting rid of masks, which we know are highly effective, or using some type of honor system, it seems to us that you are willing to put the feelings of individuals who don't like masks above the safety of not only your teaching assistants, but also, as people have noted, our staff, our housekeeping staff, the lowest earners on this campus are the ones who are going to be affected the most. So I am very much in favor, as of everybody I've spoken to within my department, of having a complete mask indoor policy and a vaccination policy. But at the very least, the mask policy. Thank you for your time.
Okay, thanks, Amanda. Tom?
Thanks. Hi, everybody. For those I haven't met, I'm Tom Kelly. I'm faculty from the School of Law. Two things. One, the Chancellor asked what we've been hearing, and what I've been hearing, and it's absolutely 100%, is that people do not understand why we are not requiring vaccinations. Now, I know that there are some, I actually, I mean, I'm a lawyer. I don't understand what the legal issues are. Maybe we'll hear about that. Again, I know that there are political issues, but in any case, that's what I'm hearing is people just can't believe that we don't have a policy that everyone needs to be vaccinated if they're going to participate fully in campus life. And then the other kind of, I'm repeating what others have said, but individual agency is of important value. There's just no question about it. But this is not an individual problem. This is a collective problem. The only way we're going to address it is through collective action. And so again, I won't go I had other things to say. I won't go further, but I agree that even though I really, really don't want to wear a mask in the classroom or elsewhere, I think it's the only safe thing to do. And so I will. Thank you.
Tom, thanks for the question. It's a question we've been asked often, so I appreciate you bringing it forward here. And I'm wondering if we may turn to Jill Moore, and maybe thank you for asking Jill to join, because Jill is an expert in this space, and I know that what we have heard from the system office on this question, it has a lot to do with the Public Health Commission's, I believe, ability to put forward a mandate around this. But Jill, could you help with this response?
Sure, I'm happy to. Hello, everyone. This is Jill Moore. I'm at the School of Government and on the faculty here, and my area of work is public health law, especially communicable disease law. I have studied North Carolina's immunization laws for 20 some years. I am unclear on the legal reason for the conclusion that public universities in North Carolina cannot require vaccines. That is not an interpretation of state law that I had heard before the pandemic. We do have a state law that applies equally to public and private universities that sets out requirements for certain vaccinations. For our students, there is an entity called the Commission for Public Health that adopts an administrative rule that says you have to have these vaccinations, and there's a set list of MMR, polio, et cetera, meningitis. But there is not a law, but a longstanding practice of additional requirements being added in different circumstances, such as outbreaks or for particular classes of students who may need a vaccination for a particular reason, such as health sciences students or students who work in particular laboratories. Someone has put in the chat a list of North Carolina schools that have required COVID vaccinations, and that's actually longer. It looks like it's lengthened since I looked at it last, but there are a number of private institutions in North Carolina. They are subject to the same law that we are, and that have imposed the requirements. And that's, I'd be happy to answer any questions about it, but that's basically the legal foundation for requirements for vaccines in North Carolina for colleges and universities.
So Jill, are you saying that you do not, that there isn't a clear legal reason why we can't require it? That this really is more of decision-making in other spaces?
I do not know what the legal reason would be. So I have to say this, what we have is and I'm sorry for getting into these weeds, we have a state statute adopted by the legislature, and then we have a state rule adopted by an administrative body. And that's the law that we have. And a court has not weighed in on what that statute means, but we have several decades of practice for what people think that statute means. And certainly it has been treated as if it was a floor of what vaccines may be required by universities, not a ceiling. And so that's the idea that we can't have additional requirements seems to treat it as a ceiling. And that's novel for me. I had not heard that in my work in this area.
And Jill, can I ask a question? I'm so sorry. This is Amir. Does this exist with EUA as opposed to approved, because I think we're in a unique space where EUA really wasn't around until the pandemic, because we've never really had to have something that needed to get turned on so quickly. And I think that that's where a lot of the question comes in, because that's how we're fielding questions from, I think, a lot of the periphery in terms of families that I've spoken to or parents of students, is it being under EUA and not approved makes there to be some resistance in understanding the mandatoriness of a vaccine.
Yeah, I think there are two separate issues there, and that's a good one. One is the issue of what the state law requires for vaccinations for colleges and universities, and that's what I was talking about. And then the issue of whether a vaccine that is still under an EUA instead of full approval by the FDA can be required is a separate issue. That is one that there have been some lawsuits filed about, and that might be determined by the courts. One way that some universities have managed that, I believe the California universities, I may not have that right, but they have said there will be a requirement as soon as full licensure becomes effective, and that's expected within the next few months. And in the meantime, they're strongly encouraging their students to go ahead and get vaccinated, knowing that the requirement is going to come into place. We certainly have other universities that have been willing to go ahead and impose the requirement. There is a very technical, I'm not going to get into it, statutory construction argument about whether the EUA, what it means. I don't happen to think it prohibits a requirement, but I agree that that's something that could be litigated. I also just want to say really quickly, I'm not speaking in my role as faculty secretary-elect or in any, and I certainly am not speaking for the university. I'm speaking just from my subject matter study over the years.
And Jill, thank you for doing that. I just want to say that what we have been told is, and again, this commission that you referenced, Public Health Commission, has been referenced when we have asked this question about the ability to mandate, and the answer has been that we do not have the authority to mandate vaccinations at our public institutions. So
let's assume, okay, rather than debate that, I mean, that seems to be the condition that we're operating under. So let's assume that that's what we're doing, that we can't, for whatever reason, require vaccinations. Let's stay with the question of masking to try and get to some sort of good recommendation on that if we can. Let's see. Donna, I think you've had your hand up for a while.
Thank you, Mimi. I appreciate the public health perspective, but I want to bring up a perspective that promotes pedagogy. Several faculty members and also students have expressed to me a desire for the faculty member to be able to be maskless by choice so that they can just articulate better while they're teaching. And so I just would like to put out there that as an option, especially if the faculty member is distanced from the students, that perhaps they could take off their mask while teaching. I mean, you know, if we still want to require students to wear it, I just think that would improve the pedagogy for a lot of our students. And I would just mention that, I mean, the grocery store and the restaurants and the stores that I've been in over the weekend or the week, many of the workers are not masked, and maybe that's a function of whether they're vaccinated or not. And you know, the employer can say, you know, what, I mean, maybe they're the ones implementing rules, but a lot of people in the industries I've been in are not masked.
Okay, thank you. Let's see, Ethan.
Thank you. I have a few other points just about perspectives that I've heard from fellow undergraduate students and just some of the questions that are still floating around the student body as we seek greater clarity. I think the biggest takeaway is that the vast majority of students I've talked to are fully understanding of the fact that masks may be required in classroom and shared spaces on campus. I think the large majority of students are prepared to come to campus in the fall and adhere to mask guidelines in classroom and closely packed social situations or indoor spaces on campus. However, I think there are still some remaining questions for a lot of students, specifically around outdoor spaces and just a lack of understanding of why masks could be required in those spaces when the rest of Chapel Hill, as you mentioned, Donna, is not masked in a lot of stores, restaurants on Franklin Street, in other public places. Also private indoor spaces, especially maybe shared common rooms in dorms, or private spaces like study rooms in libraries where students are physically separated from peers, potentially only within their family or living units. And just lack of clarity for many students around how mask policy might continue or change in some of those other less defined spaces on campus. I also see from the chat question from public comment about study spaces or libraries. I think that's a big question I've heard from a lot of students as well, that if they're socially distant, but in an indoor space, what does that mean for mask policy? And the broader sort of request that I'm hearing from students is just more clarity than was offered in the spring semester or in the previous fall about what the requirements are and what enforcement looks like. I've also heard frustration from students that if the policy is enacted or policies are communicated, but then not enforced in transparent, neat ways, then there is a lot of frustration among students about not knowing whether their peers are going to have to adhere to certain policies or communicated rules, or just what the implications or the transparent enforcement of those might look like. And that goes not just for masking, but I think for any policies that are implemented in the fall. I've heard a large number of requests from students just for greater transparency about not only as these rules and policies are developed, but as the enforcement of these policies is developed, so that students can just have greater clarity about what their experience will look like in the fall and how they can best be in adherence with the communicated guidelines that the school offers.
Okay, terrific. Elizabeth?
Hey, everybody. If I haven't met you, I'm the Interim Associate Vice Chancellor for the Equal Opportunity and Compliance Office, as well as the university's ADA Coordinator. And in those roles, a lot of what I've been hearing from employees is the desire for a graduated return to campus. And that largely seems to be coming out of anxiety about returning. I think for most folks, returning to the workplace full time is the biggest step that folks are going to be taking and resuming normalcy as we transition back to regular pre-pandemic life. And I think that, while I understand that we are going to be largely coming back on July 19th, and there won't be a broad graduated return in terms of people's schedules and presence on campus, I think that a indoor mask requirement could be a step in showing good faith from the campus leadership that we are hearing that folks are anxious and need to ease back into this to a certain degree, and provide that sort of community effort at recognizing what the last year has meant, and that people are still dealing with that and dealing with the idea of returning back to normal life. So.
Thank you. Bob, did you have some comments in response to Ethan?
Yes, I did. First of all, Ethan, thank you for your comments, and you posed a couple of that I thought maybe I could quickly respond to. First is the outdoor spaces. We pretty much, the RIT, I'm speaking on behalf of, wanted to follow the CDC's guidelines with regards to outdoor gatherings, and would likely have no mask requirements, outdoors. The other is accountability and enforcement. We have talked a lot about that, and we know that faculty and most staff do not want to play the role of the enforcer or responsible for turning over their colleagues or their students for being in violation. So that has also been on our mind, and so we wanted to make sure that if we are going to have any mandate, including a a mask mandate, that it's in a enforceable space. And we didn't want to put those individuals, who were going to be expected to enforce it in the enforcement business. So that is something to factor into. I think I think we agree with you, Ethan, that if you're going to have a mandate or a requirement, there has to be the expectation that if you violate that mandate, that there are some consequences.
Thanks, Bob, for clarifying those things that Ethan asked about. Ethan also talked a little bit about, and I think there's some assumptions around distancing. Can you speak a little bit about what the RIT has talked about with regards to distancing? Is it going to be required? And if so, how does that impact these mass discussions?
Yeah, so in general, the physical distancing requirement would no longer be in place. And so the thought was, and again, I think following CDC guidance, that unless you were in a large group of unmasked and unvaccinated individuals, then physical distancing would probably be the requirement or the expectation. Given the nature of the Chapel Hill vaccination rate and the expectations of a high vaccination rate within the university setting, we didn't think that would be warranted. So as of right now, at least, and certainly we would welcome, this group's reaction to that, but there was not a plan to continue the physical distancing requirement.
All right, let's bring in Joy and then Seth.
So just regardless of whether we have a mandated vaccine or not, we need to remember there's some people in our community that cannot be vaccinated. I currently have 2 students who cannot. One had an allergic reaction to his first dose of the vaccine, and the other one has severe anaphylactic reactions to all vaccines. So he's been obviously advised not to get it. So the masks are not just to protect the individual, it's to protect the community that can't get vaccinated, that wants to be vaccinated. So the vaccine is one issue, as Mimi said, and masking is another, and they're really not one excludes. Like if everybody got vaccinated, we don't need masks. Not everybody can be vaccinated.
Good point. Thanks for bringing that up, Joy. Wanda, and welcome, Wanda, a new member.
Amy, I really wanted to just reiterate Audrey's points before she left, because, and I recognize all the different perspectives that have been presented, but the campus, whether it's the arts and sciences or the School of Medicine, the health system, we are a campus. We are in large part a large community, but in large part a closed community with different people from different backgrounds and different access, different medical issues, and different exposures. And so while I recognize and respect the individual thought and perhaps the individual burden that people may encounter, that we do have to look at it as a public health community perspective. And we can't emphasize that enough. And I think particularly when we think about issues around equity, particularly as it relates to the staff, that the mask mandate in terms of wearing a mask indoors is necessary for safety across the board for all comers. I will say that I've been in different stores as well, and there are people largely who don't have on masks. Now there are people behind the counter who don't. I think those circumstances are somewhat different than the campus, because you could elect to go to that store, you could elect to go at a different time, at a time where it's not quite as busy. You could elect not to keep that cashier's job, or you've elected to show up as a cashier without a mask. I think the campus is a different story, because we do have a mission and vision here, and that's to show up and to teach and to train the next generation. And there's less options in the situations in which we work and live on campus.
Okay, thank you. And Seth.
Thanks, Mimi. So my take is that we probably need to go into the fall semester being more conservative on masks for a lot of reasons. If there's a point at which we can let up, it's easier to go that direction, right? The CDC has not necessarily done us a lot of favors with their recent guidance, because now, as people are talking about, people have loosened up in mask wearing. I notice it when I go to stores when everyone was wearing masks, and now, sometimes half are, et cetera. So that's going to be challenging. I think for a lot of reasons, though, we probably need to go in to the fall semester being a little bit stricter. and probably requiring indoor masking as much as I, as a professor, don't want to wear a mask when teaching, although we could talk about some of the things that were raised about that issue. But I would also say that we have to remember that the only thing that gets us out of this pandemic are the vaccines. And we have to create every incentive we can for people to get vaccinated. The fact that we're going to tell people, oh, go get vaccinated, but you still have to wear a mask is challenging. And this is one reason I think why CDC is trying to show people, hey, these are the benefits if you get vaccinated. I saw a message that came out of the university, and I don't know if this is still the case, but I thought it was brilliant. This came from us, from UNC, from someone at UNC, that students enrolling in the fall, if they're vaccinated, they don't have to get tested. They don't have to be part of the mandatory testing program. But if they are not vaccinated, they still have to go for the required testing. I don't know if that's the case. That's brilliant, because that creates a real incentive, like, hey, get vaccinated, and here's this massive burden lifted off your shoulders. You don't have to keep going in for this annoying testing. But if you're not vaccinated, you do. So I also think we need to really think about ways to promote vaccination among those who are not vaccinated, to create those incentives. And then, of course, if it were me, I would love for it to be required at UNC. I know that we've talked about the complications, but in terms of people, there would have to be exceptions, obviously, when we're talking about vulnerable folks that can't get vaccinated. I would assume that, there would be exceptions for those folks, but the best thing we can do to protect vulnerable people is get vaccinated. And the masks, in my mind, is just sort of a Band-Aid bridge until we have herd immunity. Thanks.
Thank you, Seth. Richard?
Yeah, I really appreciate all the comments, and I would like to direct a comment. I know Audrey's not here anymore, but placed in the chat, and then I'm going to make another comment after this, is, just note all students have not reported, and she was expressing that she thought that it was only 50% reported to date, and possible those who haven't reported are less likely to be vaccinated. So if students are at 85%, then great, but she was just claiming that she wasn't sure of that number at that point. And the next thing I'd like to mention is that, and I hope I'm wrong, and Amir's on the line, and whoever else is in the ID field, please chime in. But I think there's two reasons to suggest perhaps, and I hope I'm wrong, that we could be in, kind of an eye of a storm right now as far as the pandemic, where things are really good. And the two reasons why I would say that, the first one is obviously the acquired mutations that happen over time as the virus maintains a foothold in several communities throughout the world, resulting in variants. And those are just going to continue to happen, and they jeopardize the effectiveness of our vaccines. That's the first one. The second one, obviously, is as immunities start to wane, the longer that we are in this pandemic, we are going to have to implement a strategy for boosters, whether it's third with the Pfizer and Moderna, or two with the Johnson & Johnson. And that protocol hasn't been fleshed out yet at the moment, which creates a gray area for the type of campaign that's going to have to take place, in which we're going to have to convince people to get like a third shot or a second shot. Put all that together, and we could be approaching kind of a gray area with this pandemic, in which we could very well see a rise of cases and ultimately a rise of, unfortunately, of fatalities. And so I do think it would be a good measurement to maintain the culture of mask wearing, especially in indoor areas, because we may very well have to go back to where that is our normal again. Thank you.
Yeah, Richard, if it's okay, I'm going to jump in here, Mimi, just to answer just a few questions and bring it up to speed. So I think a lot of good comments were made, and just to kind of address a little bit about what's going on. I agree. I mean, I hope that one thing that we've learned from being in the pandemic is that there's really no certainty, right? There's going to be variability in what happens. So what we try to do is use the best available information to make decisions. One, I think it's a little bit of an assumption to say that just because someone hasn't filled out the attestation that they are less likely to do so. What we know is that some of the students were not actually eligible to register yet. And so that's one of the reasons why they haven't. So just to kind of put a little bit of an understanding behind that, we've associated this with the Connect Carolina login for registration. So that's one reason why we still have some pending results. The second thing that I would like to say is that, yes, there's a comment about the Delta variant being more prevalent and rising mortality and morbidity in other countries. I think that is a good point to bring up, but maybe a little bit of an unfair representation because vaccination rates are differing from country to country. So please remember that one of the things that I think is really important and crucial in this is that right now we've been kind of living in this environment of number of cases being a really important use and justification about what we think is going on. That was really important in caseload when we didn't have vaccinations to have the secondary effect, which is what we've seen consistently with vaccines is that it decreases hospitalizations and mortality. So that's it. That's the point that I think is going to take us a little bit of time to shift into and understanding and feeling good about is this mindset of the number of people infected is greater than the outcome. And I think that we have to flip the boat on that. And outcome-based theory is going to take over at some point when we get more comfortable. It may not be now. And then just the other thing too, to think about this, there were some comments as to, kind of what has been going on, and interested to know, has this changed in terms of what we've seen from variants that are out there right now and what's been going on with mask mandates being lifted, et cetera. So the state of North Carolina has continued to decrease in number of cases, number of hospitalizations, and mortality throughout all of these different levels, whether it be mask mandates being removed, changes in limits in population size, and I'm saying that in the last month, changes in limitations in population gatherings, et cetera. So there hasn't been like what we maybe saw earlier in the pandemic, which is rises after, for example, Labor Day holiday or around the Christmas holidays or winter holiday season. We haven't seen those yet from what has happened with masking. So just to hopefully give a little bit more information between both comments and questions that have been posed.
Thank you, Amir. And thanks, Richard, as well for your comments. I want to pull in real quickly another comment from the chat from the public poll. Our campus is frequented not just from members of the Orange County or campus community. Many staff will be required to interact with individuals outside of our community, and we will have no way to know if they are or are not vaccinated from a community that has a high vaccination rate. With no mask requirement indoors, staff interacting with visitors to our campus will be largely unprotected with no option to ask visitors to wear a mask. I think that's an important comment from the public poll.
Thank you. Yeah, I also, Aaron Nelson, you've put some interesting ideas in the chat. Do you want to bring those into the conversation?
Sure, and the public health professionals may know more, but Ohio or North Carolina with vaccination gives you college scholarships, or vaccination puts you in a drawing for cash or prizes. Right now, for athletic tickets, our tradition is if you go to the less popular athletic events, we put you in drawings for the more popular athletic events. Is it not our vaccination status that could create that? Would faculty or staff be motivated by, we'll waive your parking. We're going to do a drawing every month for someone's going to get a free parking. Someone's going to get premier parking. We have vaccinated parking. What is the motivator that might excite people to be a part of something? What do we have to give that might not cost a lot? We want to give away 5 dorm rooms this year. That doesn't cost us much. Is it worth putting people in drawings? I just don't know if those are motivational. I will say that my 17-year-old is paying attention every day on whether he's going to win the North Carolina College Scholarship Lottery. We'll wait to see whether that happens.
Aaron, let me jump in. Thank you. Great suggestion. And many other places are doing the similar sort of incentivizing students, faculty, staff, and we're working on this as we speak. I agree that we need to do everything possible to get as many people vaccinated as possible. So we are looking at opportunities for sporting events and all sorts of fun things that we think our community members would like to attend that they might not otherwise have access to, and we're going to do something similar. We're continuing to monitor the registry weekly to see what those numbers look like. So stay tuned. and others may jump in, but this came up in the leadership team meeting earlier this week.
And would it be possible, I mean, can schools do this individually, schools and departments, have some sort of drawing for their students or their majors or their graduates, students or their staff or whatever? I mean, is that okay? If I wanted to, I'm the head of the doctoral program for the School of Social Work. If I wanted to say I'm going to have a drawing and give people a gift certificate to Med Deli, if we get 100% vaccine, whatever, is there anything prohibiting me from doing that?
Not on the student side. We've looked into this. I don't know, Becky, from an employee side, if you have any concerns but I see no reason why we can't, unless Becky, you're aware of anything.
On the employee side, we're not allowed to ask, and we are not going to be able to provide individual percentages based on unit. So you will not get information that says in the School of Social Work, 80% of staff are vaccinated, but rather we'll simply have aggregate numbers. So we can say across the university, 72% of faculty and staff have reported that they're vaccinated. That's a made up number. That's not true. Truthfully, our numbers are quite a bit lower on the faculty and staff reporting right now. And if I could make an ask of all of you, we know that one of the biggest concerns that faculty and staff are raising about coming back is uncertainty about whether their colleagues are getting vaccinated. So we can ask at the center for people to go in and attest that they've been vaccinated. But the single best thing you can do is use those local networks at the school saying, you're going to get to see that percentage go up, which should maybe reduce your anxiety some. But the only way we can see that percentage go up is if people go into that system and attest. We'll continue to push from the center. We'll try to come up with ways to have people be able to attest, who do attest, get something, but we're not going to be able to report on a unit by unit or a school by school level on the employee piece. The student piece is a little different.
And I can add a little bit to that. And I know Amir and I've had conversations. We can break it down a little bit more than that on the student side, but probably not by department, because especially some of the smaller departments, but between graduate, undergraduates, maybe the college, but the smaller the number gets, you run into issues with HIPAA and FERPA and other things.
Okay, let's bring in, I saw, Samuel, you put your hand down. Did you, but you're a newer member, so I wanted to say hello. And
I just had a super brief point, if I may, just super quickly, talking about those kinds of rewards that were mentioned. I think everybody should remember that as an undergraduate college student, we're college kids. Virtually anything will motivate us as far as something that's free. Throw some Duke tickets on the line. You're going to at least see some people get vaccinated. And then secondly, just a reminder that I think as I've spoken with students and constituents from the undergraduate senate, you have students who are not going to be vaccinated at all because they just are going to choose not to, claiming whatever exemption they may. But then you have that additional group that is, waiting, is what they'll tell you, to see certain outcomes or for the vaccine to be approved for regular usage by some of these regulatory bodies. I think that's a group that can be pursued in a stronger manner with some of these incentives, because some of those students are intending to get it and they're waiting for whatever reason. But something like that could certainly move at least a few students in the right direction.
Thanks, Samuel. I want to speak to something really quick that Becky, you mentioned. And yes, faculty and staff reporting levels are fairly low. One thing that has been brought up is I don't know that the EHS reporting mechanism has been very widely publicized. So I think that efforts to kind of increase faculty and staff awareness of that reporting capacity is going to be really important to get those numbers to more broadly reflect the levels that we're seeing on campus. I know I only remember seeing it maybe once. So I think that would be a really helpful tool in getting a better and clearer picture around who is and isn't vaccinated.
Let's bring in our other co-chair, Lamar.
Hi, everyone. And I apologize if I missed this. I just wanted to know if, I don't know, the provost or the chancellor or anyone else that are in the operational conversations, can provide some insight into what plans may be to galvanize students of color in particular centered around the vaccine and those from underrepresented communities. I think I know I personally worked with the communications department some months ago about this, but I don't know. I haven't seen any data to show there was an uptick in students that were choosing to get vaccinated from that. But I'm interested in knowing if there are any plans centering around that specifically.
Provost Bluin, is that something that you would address? Or?
Yeah, so we don't have any statistics, Lamar, on any of the demographics within the university for all of the reasons that have been stated. We just can't ask individuals even whether or not they've been vaccinated or not. So that information is not available. We have been working with comms extensively, particularly within the roadmap implementation team to try to get the word out to all of our students, all of our faculty and staff, encouraging everyone to get vaccinated. And we have been working with the town of Chapel Hill and trying to communicate more effectively to some of the groups that have been known not to be as inclined towards vaccinations, which would include our minority population. So I don't know if we've been as effective or whether we need to be more aggressive, and would certainly welcome hearing from you or your colleagues any specific recommendations that you would have for us to consider moving forward in advance of the spring semester of the fall semester.
It would be a great, in the same way that I think I'm thinking about faculty and Katie's thinking about staff, to think, what is it to have student government active in that, promoting that as well.
And maybe just Kevin, I just jump in before I unfortunately have to jump off into a 2:30 meeting, but I think Lamar raises a good question. We've had a lot of success back in the fall, and we've looked at what other institutions have done around public service announcements and engaging our students in helping to, we'll produce them and get them distributed, but helping us think about the right content and messaging that we think can help galvanize, to put in Lamar's words, galvanize these populations to try to encourage them to get vaccinated. And I wish, as Provost Bluin said, I wish we did have a better sense as to what those percentages were, but we just can't ask those questions through the surveys and the registry in the way that would help inform us a little more. But I have to jump out. I just want to thank everyone, and I'll follow up with Provost Bluin and Bob and Mimi and others later on. Thank you.
Thank you. Thanks for being here.
Yes.
So maybe Lamar, we could ask you or if you had suggestions around even participating in some of these public service announcements directed, towards students or students of color. I think what our comms people would tell us is that, to be most effective, you have to have someone, who the audience that you're targeting, has a strong identity toward, and have a high level of respect and trust toward. And so maybe that's something that we could work with you on.
I don't know if I check all those boxes. I'm just joking. But I most certainly will volunteer myself. I think I probably speak for my colleague across the aisle, Neil, who leads the graduate and professional student government. That I believe he has a trust as well of his constituents, and all the other students on this call as well. I think you have it exactly right in my mind, and I'm just gonna have to do some more thinking on this. But I do think that student-led communication works the best. I think similarly for staff and faculty. Faculty-led and staff-led communication from familiar faces, if you will, works. I do know that a particular concern that I was getting was that, what population of students in particular were the most resistant to getting the vaccine or buying into this in particular. And there was this belief at first that it was people of color or students of color. And I'm not really 100% sure if that's the entire picture here. I will just say, I think because there's a lot of student programming in the multicultural area, that they've been doing a lot of this push themselves and for student groups. But I will also say that just given the amount of event planning I'm aware of, the time to reach out to them will probably be now because I'm aware of a lot of events and things. Students are excited to come back in fall. I put it that way. And so, given that, I'm not sure they'll make the time, I should say, to get vaccinated as opposed to doing it now.
Yeah, and I know that only 55% of the students, have responded to our survey, and we are expecting, a larger turnout. But to the credit of our students, 96% of them have declared that they're vaccinated, and 85% of those have been willing to upload their vaccination certificates. I just want to thank our students and congratulate the students. They have done an outstanding job. In contrast to that, only 25% and 30% of our staff and faculty have declared their vaccination. I think, Katie, you did indicate that it's not as easy and that they don't get as many reminders. And so we need to do better in terms of that. But I am very encouraged by the participation of our students and their willingness to share their vaccination status, at least in confidence.
And in conjunction with that, we haven't even talked about the testing that we're looking at for the semester coming forward. But the students who are not vaccinated are still going to participate in some cadence of regular testing like we did in the spring semester. We were very lucky that we set up a very successful lab with the help of a lot of people. Over 1,000 people helped get this going, and that includes a large swath of students who helped be volunteers through the Carolina Service Corps. And again, just another highlight of how well the students have responded during the pandemic. But we are going to still participate in testing program for the students that are not vaccinated. We were able to show over the course of the last semester, in case people are interested, over 180,000 tests were completed on our campus with a prevalence or a positivity rate of like around 0.27%. So I think that we did show that the testing program helped, and we are going to continue to do that in the guidance and in the work that has been recommended, which is they're largely asymptomatic testing for vaccinated patients or populations is not recommended. And that's why the exclusion of those that are vaccinated is there.
So let's just, before we move on, I want to bring Kate and Ethan into the conversation, but also, so Katie has put the link for faculty and staff to upload if they haven't. We should probably all be sending that out to our relevant groups, and hopefully Central Campus will as well, because I think, the lower rates for faculty and staff is because we don't have to register for classes. There's nothing that forces you to do it. You see the email, maybe it gets buried in your email, you don't read it, whatever. So I think that needs to come out more and more. And then let's see, there was something else in here. Lamar is bringing up the question, graduate students are included, I'm assuming, in that 50, in the percentages that we're getting, or is that only?
Yes, all students, faculty, graduate students, professional students, and undergraduate students.
Okay, all right, terrific. Kate, we haven't heard from you yet. Welcome.
Hi, thank you. I am the Vice President for Advocacy and Government Affairs with the Graduate and Professional Student Government. So I had a couple of comments. One, before, I don't want to derail this conversation about vaccination policies on campus, because I think it's really good. I have some things to say about that. But one thing before we continue with that is we haven't discussed, it was kind of touched on earlier, is I'd like to know what kind of discussion has been happening around for in-classroom instruction for instructors who will be masked, just what kind of mitigation measures there are for students who are hard of hearing. Because lip reading is very important for those students in the classroom. So I hope that there's something being done or some discussion on how to handle that when those classes do start. And to touch back on some of the points that we've been talking about with vaccination. So one thing is, I think for clarity, we still really don't truly know what percentage of students have been vaccinated or plan to, because only 50% have reported. And that's great that it's so high so far. But like we have kind of touched on a few times, it's hard to know that there's going to be quite as high rates among those who have not reported yet. So I think just keeping that in mind when we're thinking about the success of the high numbers so far, just being realistic about what that could mean for those who haven't reported yet. And the other thing is in the chat, we have had some discussion going on. I don't know if it's been really talked about that much yet. Ideas about other incentives, about privileges for accessing certain spaces on campus tied to your vaccination status. So things like that have been touched on in the chat. I don't know if people watching the YouTube live stream can read these messages, but things like accessing gymnasiums, extracurricular activities that aren't necessarily, they're optional for students who attend UNC. So that's just something I'd like to hear more discussion about, what people have been hearing and what people's opinions are. There seems to be precedents of other schools doing this and planning on doing this. And I would be in support of exploring these types of options. Thanks.
Yeah, can we make it, I mean, I've asked this question too, and I don't know that I've necessarily heard an answer. Chris, maybe you can speak to this, is that can we, say that students who are able to be vaccinated, who have not been vaccinated, can't attend particular kinds of events on campus or use the gym or, some of these things that are optional?
So I will answer to my knowledge. I'm not a lawyer and not a student affairs expert, so I will, and Bob may
on the call that might be able to, yeah.
Bob may be able to. The problem, and some of this has been in the chat, I think Ethan brought this up. There are some folks, as Joy and others have said, who just cannot be vaccinated. And how do we handle those versus those who choose not to be vaccinated? So you run into those problems. Our Hall Pass app is going to, the way Hall Pass will work will show if you're in compliance or out of compliance. You are considered in compliance for the entire semester if you have attested to being vaccinated. If you say no or prefer not to answer or do not answer, as Amir said, you go into our mandatory testing program. Then if you miss a test, your Hall Pass says you're out of compliance. If you're tested, your Hall Pass says you're compliant. That's really the closest that we would have to be able to ask somebody if they're vaccinated or not without making them show us a card or something. So there's a logistical problem there as well. Bob, anything you want to add to that?
No, I think that's right. With regards to access to some areas, like athletics, we have been working with Bill very closely as we've been trying to open up more and more gym spaces, and we have actually linked those to vaccinated with some sign or evidence of the fact that the student has been vaccinated. So I think, Kate, to your comment that we have been exploring those for the summer, as we've approved many of these programs, for the athletic facilities. And one of the reasons why we were, I think, fairly aggressive in wanting to do that because of the importance of having these extracurricular activities available to our students throughout this period, even in the late spring and throughout the summer. So those could be extended, into the fall semester if you think that would be helpful, Kate.
Ethan, Neil, I don't think you've spoken yet, so let me invite you in.
Of course, thank you, Dr. Chapman. And for those who I haven't had an opportunity to meet, excuse me, my name is Neil Swami. I'm the president of the Graduate and Professional Student Government and a PharmD MPH candidate here at UNC. I want to elevate some of the comments that Lamar and Amanda made respectively regarding minority student populations and mask wearing indoors. So to the first point, I do think it is important to acknowledge the numerous and nuanced reasons that students of color may choose to not want to be vaccinated. But I think our messaging has to be very careful to not make it sound like students of color are being singled out for their decision to or to not vaccinate. This is a community responsibility. And because we don't have data about which demographics of students are choosing to or to not be vaccinated, we need to make sure that that messaging runs parallel to a larger campus message about what it means to be responsible and pursue vaccination as a means of keeping everyone safe. I can imagine that for undergraduate and graduate and professional students in the classroom, it could be very frustrating to receive messaging that makes you feel targeted and then walk into a space where students are not wearing masks or you don't feel safe in your classroom by virtue of the physical constraints that accompany that. I also want to emphasize the points that Amanda made about teaching. Our graduate students across campus work tirelessly every single day to provide high quality instruction to our undergraduate students. And if there are not conversations about how these graduate students are being affected by mask protocols, that's something that we need to keep at the forefront, because of course there are going to be students who don't want to wear masks. And of course there are going to be students who perhaps have reasons that masks affect their learning. As Kate pointed out, there are students who may have hearing impediments or needs that could be affected by the presence of masks in the classroom. But I think the central message I want to hone at is that this is a community responsibility that's not going to dissipate just because we focus messaging for particular student demographics.
Good point. Ethan.
Yeah, I just want to return quickly to the conversation of restricted access in certain events or certain facilities based on vaccination or testing status. I think, Chris, you brought up that there are multiple concerns or problems that would have to be worked through, but in that way, I think that they are workable problems. We were talking in the chat about, for example, individuals who may have other health difficulties or reasons that they cannot be vaccinated at this time. And Elizabeth mentioned in the chat that ARS can provide, services to try to accommodate that, to make other exceptions, and to make sure that those students aren't left behind if it was to be implemented. And I think that it is another way to effectively incentivize students to get vaccinated or to maintain testing or to maintain compliance through the fall, as many, as we've heard, grow tired of the pandemic or grow tired of restrictions. I think there are other ways that we can, work around that and make facilities another incentive to do that. I also think, Provost Bluin, you mentioned that the gyms and athletic facilities may be exploring these options already through the summer, and I would highly encourage that continue to be used through the fall. But just to make sure that we're also including that equity piece so that students who are ineligible to be vaccinated at this time or choose not to based on health reasons can still have access in other ways or can be accommodated and made sure not to be forgotten in those sort of policies.
So I can answer a little bit of that. And I was looking for it and I found there was a memo that went out to all UNC system schools last month that laid out some of the guidelines from the system office and whether it's system policies or law, we still abide by those. And some of the things they said we can't do. We can do and can't do is, and one of the things we can't do is we cannot prohibit unvaccinated students from attending in-person classes or participating in in-person activities on campus. So
we couldn't do that.
So our hands are tied. And
okay.
We also can't prohibit them from living in campus housing, and we can't ask their vaccination status to where they want to go. Now, I know housing has worked closely with our incoming students in housing to try to pair folks without asking your vaccination status, but let folks come in pods that they know they're vaccinated and they want to live in the same suite, things like that. So there's some creative things that are being done, but I just wanted to put that out there.
Hey, Chris, sorry, this is Tom. What was the source of the rule that you just quoted?
The UNC system.
Thank you for that clarity.
Real quick. I'm sorry. I want to chime in on that real briefly. So I thank you for that, Chris. It provides a lot of clarity. I'm wondering, though, even if we cannot prohibit students who have not been vaccinated from entering these spaces, can we still then focus on trying to, in an equitable way, reward and or prioritize students that can be? So, for example, if you have been vaccinated, as you all know, we have a football lottery here for students. You may enter the football lottery earlier, or we may have a larger set of tickets for the football lottery for students who have been vaccinated and still provide some to those who haven't been or such. I'm not a lawyer, so I'm putting it out
But no,
there.
that's a very good question, Lamar. And I don't think we can say if you're unvaccinated, you can't come to participate in the football lottery. But we can say, to Aaron Nelson's point, we can go and say we're going to do like the state of North Carolina. For those that have uploaded their cards in the EHS system, we're going to be entered into a lottery and we're going to do this, or we're going to get that, or you're going to get this. So, so yes, to your question, we can do things like that.
Yeah. So Tom is putting something in the chat that is true, I think. So that these decisions, there are decisions that have been made, and exactly why they're being made. I mean, he's calling them political decisions. They are decisions that probably please particular constituencies. So, they are not necessarily because a court of law has ruled on any of these things. So that's an important piece. Some people have said, can we do whatever and then, just go through the legal challenge? But then you have to recognize that legal challenge may keep you from being able to implement anything in the meantime. So, that doesn't necessarily get you where you want to go either. So it's a difficult place to be. This is one of the other constraints of being in a public institution. We're seeing a lot of them at the moment. And so, we're working with what we have. So we probably need to kind of.
Well, and I think it's important, maybe too, that these rules don't just apply to Chapel Hill. They're system-wide rules. And I know you participated in some forums and others with the system, and some of our HBCUs had some concerns about different things. And so, and I'm not saying they're right, they're wrong. I'm just saying it wasn't done without a lot of input, I think, from a lot of people, agree or disagree with the outcome.
Right. So that's the playing field we're in, but we can incentivize. And I think that this is really, where we probably would do well to focus our attention. And then also, I guess one thing I found myself thinking about listening to this is the idea of consistency. So, the simple mask mandate, if you're for everyone, if you're inside, yes, if you're outside, up to you. That's clear. And then with exceptions for someone who's hearing impaired, that needs to lip read, those sorts of things may be something, it seems to me, to consider. It just seems like clarity is as important as is trying to make everyone happy, which we're probably never going to do. So I'm just going to throw that out there for some discussion. Neil?
Of course, thank you, Dr. Chapman. And I appreciate the comments that have been shared thus far. And I want to communicate a comment that was shared with me with some folks from my team who are watching the live feed. And so there have been some concerns that incentives for students who either maybe disclose a vaccination status or participate really in any sort of behavior that we want our students to do is alienating to students who have differing abilities or have, as has been discussed, medical reasons that prohibit them from being vaccinated. And so what I'm wondering is, and I'm not a legal expert, and I apologize if this has been discussed and it went over my head, but is it possible to, instead of having formal incentives, make it very clear that we encourage physical spaces on campus? I guess what I'm trying to say is, instead of having clear incentives one way or another, could we simply say and outline the public health reasons as to why students who are not vaccinated, either by virtue of choice or by virtue of the fact that they are medically unable to be vaccinated, should consider participating in virtual opportunities, and then focus our efforts on the masking themselves as a preventative measure. That way we are not creating an incentive program that inadvertently harms students who are just not able to be vaccinated and shouldn't have to disclose that part of their medical identity in order for them to be heard.
So, Mimi, can I jump in here real quick because it's very hard. I think that one of the things that has just come through resounding times over and over on this conversation is that when we talk about personal choice and the ability to make a decision, we have to view it from both perspectives here. And Neil brought up some really excellent points here. For every time that we've talked about the good of being able to do something to encourage, we come back and we say that there has to be some initiative and some ability to protect people who don't, for whatever reason, have the ability to get a vaccine. I have been involved in COVID work for 18 months. And I totally agree with you. I think what we need to do is promote the culture of inclusiveness for protections that person feels. If they feel like wearing a mask all the time, inside and outside, is the right thing for them, we promote that. If people think that it's okay for them to be outside and not wear a mask and congregate in a group of 5 to 6 people that they feel comfortable being around, it's very, very hard because we don't have a placard that says, I'm vaccinated, I feel good about doing X, to not invade into someone else's privacy and ask them. And I don't even think that we really should get into the stance of asking people before you go into a room or into a space, are you vaccinated? I think that's a really tough place to be. So I would hope that what we try to do here is promote the decision-making that's across the board and protect as much as we can in the ability to do so. And if you're one of those people that feels most comfortable wearing a mask indoors and out, then I will support you 100%. I think we should promote that on our campus too, to promote that if that's what people decide to do.
So Amir, are you saying then in general that you do not favor incentives?
I think it's very hard with incentives because every time you bring in an incentive, there's going to be that population. So right now, let's say, for example, if we were looking at the percentage of the students that filled it out, we hear just as much from the 4% that maybe were not filling it out or saying that they had been vaccinated about their desire to have a campus experience as we do the 96% that did fill it out. So I'm saying if our goal is, I think we need to understand what the goal is. If the goal is to have an inclusive campus that's promoting as much health as possible, but also inviting as many people as we are as a public institution, as a flagship campus, we have to look at both perspectives. And so I think that you're going to hear, just like Neil mentioned, you're going to hear students who say, that's not fair to me if I can't be in an incentive pool because I didn't get vaccinated because of my immunocompromised state, or my doctor told me not to, or I have an allergic reaction. So I think we just have to be careful. I love the idea of making sure that we can promote vaccinations as much as possible. I think we give as much information out there. And the thing that I have to go back and say, if you're vaccinated, your chances of having a severe hospitalization and or mortality from getting a COVID infection that's superimposed is almost negligible, is a reason enough for me to want to get vaccinated. But I understand if some people don't. So I think it's a tough place to be.
Okay. Well, this has been a really good discussion. Lots of interesting points, lots of good points made by so many people, and we are at our time. So Chris and Bob, what are you anticipating as next steps?
I mean, go ahead.
We know that we need to move forward rather quickly. Chris and I and Becky will be working on communications, to the community. We need to have a follow-up conversation with the chancellor. And Mimi, I think that it would be great if the co-chairs of this committee could weigh in on the mask wearing issue. I know that we did not come to a consensus here. So a lot of the comments that you made were very reinforcing to comments that we've heard before and positions that we've heard before. It is a complicated area. If I were to get one general message from all of you, I think there was a lot of leaning towards being more cautious and being careful as we launch the fall semester.
Okay, well, and you, I think the chancellor said that he thought that he would be convening this group at least one more time during the summer. So we'll look for that. And
that's my understanding as well, Mimi. Probably a little later in the summer.
And really quickly, can I get some clarification from Bob and Chris? When does the RIT plan to announce the decisions regarding the community standards? I'm hopeful that it would be well before the July 19th return to campus state that staff are facing, because there's a lot of uncertainty around that piece. And I think having that information at their disposal will be kind of helpful in disseminating some of those fears.
Yes, Katie, yeah, you raise an excellent point, and that's very, very much on our minds, to have something out there very, very soon. We were waiting and really for this meeting and to begin to have get at least some input and feedback from the CCAC before we did anything publicly. And we'll need to continue to think about the comments that you've all made here. And then work that into a final recommendation. But we should be able to make that announcement, I think, sometime soon. I know that Becky is very anxious to get a decision on this so that she can begin working on her communication strategy, particularly to the staff.
I've heard once or twice that people want to know.
Thanks, Becky.
All right. Well, thanks everybody for doing this on a Friday afternoon. And I hope everyone has a